Good evening. The Chairman, Presidential Task Force on COVID-19, members of PTF, gentlemen of the press, both in remote areas and those who are live here, our viewer and our listener at home. We want to welcome you to the rescheduled national briefing of PTF on COVID-19. Today is Tuesday, 3rd November 2020. It's a pleasure to welcome you to today's national briefing. And as usual, to kickstart today's briefing, may I please request the chairman of PTF, who is also the SGF, to now kickstart the briefing with opening remarks. The SGF, sir.
Members of the Federal Executive Council, distinguished ladies and gentlemen, gentlemen of the press, our apologies again, because we ought to have started this meeting at the media briefing at 4 o'clock. However, I welcome you all to the national briefing by the Presidential Task Force on COVID-19 for today, Tuesday, 3rd November 2020. The Presidential Task Force could not brief the nation on Thursday, 27th October, which was Eid al-Maulud and had been declared a public holiday in our country. Similarly, we could not brief yesterday, Monday, 2nd November, due to other exigencies, including engagements with the National Assembly on the 2021 budget. These are very trying moments and quite a lot of conflicting engagements. We nevertheless use this opportunity to felicitate with the Muslim Ummah on the commemoration of the birth of the Holy Prophet Muhammad. And as we remember his birthday, we pray for mercy upon humanity and protection against the coronavirus pandemic. May the Almighty God accept our prayers. The Presidential Task Force continues to monitor situations around the world and will continue to draw your attention to the rising number of cases. Global cases crossed the 46 million mark, with USA, India and Brazil accounting for 50% of all global cumulative burden. A number of countries in Europe have been forced to order their second lockdown due to spike in cases. The reasons for concern include the fact that as of Monday, 2nd November 2020, global statistics showed the following. Global cumulative cases now, as of today, is 47,387,837. Global number of days is 1,212,479 fatalities. The UK and France have continued to struggle with record increases in numbers and have reintroduced total lockdown to control the spread. The United States continue to witness record daily increase in number of confirmed cases, especially given the fact that it is in the middle of a presidential contest. The African continent has at the same date recorded a cumulative total case count of 1.813 million and 800, including 43,461 deaths. And unfortunately, the head of the World Health Organization is reported to have gone into isolation out of abundance of caution and the need to underscore the importance of contact tracing and also ensuring compliance with advisories from the World Health Organization and other national bodies like the NCDC and the Presidential Task Force. When we say isolate, it is imperative that you isolate. When we say quarantine, it's imperative that you do that out of abundance of caution. The Presidential Task Force, as at the last briefing, cautioned on the need to avoid complacency on account of the low number of infections published daily and the possibility of a second wave. That advice was premised on the fact that risk perception remains very low and sample collection has been on the decline. In the midst of all this, the nation has experienced several large gatherings, particularly events during which non-pharmaceutical innovations were not really observed. The situation in Europe and the reports from the USA showing the consequences of non-adherence are quite vivid. The Presidential Task Force is highlighting these issues repeatedly because we remain at risk of importation, having opened our airspace, a massive spread as a result of the protest by the NSAS and the continuation as exploited by all sorts of tendencies in the acts of looting and cause of mayhem all across the country. The next week or two remain critical because that is when we are expecting to see if those events were super spreaders. The PTF has noted with sadness the failure of Nigerians who arrived from abroad to present themselves for the in-country PCR tests, which they signed up to and paid before arrival. Statistics emerging from our records show that only 1 out of 3 passengers have shown up for the in-country test. 1 out of 3 passengers. That's a dismal number, and it ought not to be so. As you may recall, the PTF announced the guidelines on the reopening of the airspace and the obligations of arriving passengers. The Presidential Task Force similarly announced sanctions as a consequence of any infraction. Having observed serious non-compliance to the level of 65%, the need has arisen to activate the sanctions, which includes the suspension of the passports of such defaulting individuals for a period of 6 months minimum. The National Coordinator will elaborate further on this. That was part of what they signed off to, and if they do not obligate themselves to conduct the in-country tests, they will be endangering their loved ones and their communities. And we need to activate the sanctions. As part of the strategy of the Presidential Task Force to deepen community engagement, I addressed an emergency session of the National Executive Committee of the National Council of Traditional Rulers this morning. The contributions of our traditional rulers to the successes so far recorded in the national response cannot be overemphasized. Accordingly, I acknowledge and thank all our traditional rulers for their support and urge them to continue to do more, especially in the areas of risk communication and community engagement. Adherence to the non-pharmaceutical intervention measures and the need for people to come out for testing were also emphasized. Finally, I wish to inform you that the Presidential Task Force has revised its meeting and briefing frequency to once a week to allow members to carry out other functions and activities, because invariably all the ministers and members of the Presidential Task Force are currently engaged with the issues of engagement at the National Assembly and dealing with other issues, particularly engagement as an aftermath of the NSAS protests. So we will not have the benefit of having all the members at the same time for the number of days that we want them to meet to continue with the briefing. But we will make sure that at least once a week we meet and also have an opportunity of speaking through you to the entire nation. However, this does not preclude the need to call for emergency meetings and briefings when the need arises. With effect from Thursday, 5th November 2020, therefore, the national briefing would only hold once weekly. Let me use this opportunity to once again thank all our collaborators, especially the media, for the sacrifices, understanding, and the dissemination of information to all Nigerians. I now invite the Honorable Minister of Health, followed by the DG Nigerian Center for Disease Control, and the National Coordinator to update you from the technical perspective. Once more, I thank you for listening and wish you a pleasant evening. Thank you.
The chairman of the Presidential Task Force on COVID-19, honorable ministers, cabinet secretaries, national coordinator, director general, directors, ladies and gentlemen, a total of 63,036 confirmed cases have been recorded as of today, 3rd of November 2020, out of 627,600 persons tested so far for COVID-19, with 59,328 cases treated and discharged. We have sadly lost 1,147 persons to the disease in 36 states and the Federal Capital Territory. We currently have 2,561 active cases, which are being managed either at home or in treatment centers. We are also concerned about the decline in the testing rate in several states of the Federation. Records show that only Lagos and the FCT have met the testing target of at least 1% of the population. Plateau, Rivers, and Gombe have reached 50% of the target each, while 25 states are yet to reach 25% of the population, of the target of the population. We do not have the confidence to draw firm conclusions on our status till this situation improves. Our concern is heightened by several emerging factors that challenge whatever gains we may have made in recent months. Number one is the inevitable need to reopen air travel to stimulate economic activities. Number two is the imminent reopening of schools and youth service operations, again necessary for restoration of social order, but which global experience links with spikes in COVID infection rates in most countries. The effect of recent social agitation and unrest, with the attendant disruption of services and the widespread breach of infection prevention protocols. And fourth, the growing lackadaisical attitude to COVID-19 and disregard for safety and infection prevention and control measures, which I must admit is not peculiar only to our country. Preliminary reports show that contact tracing and case finding have declined in states with a consequent reduction in the number of persons tested. And I therefore renew my call to all states and stakeholders to step up testing capacity, to help identify positive cases for isolation and treatment, and to protect the rest of the population, which is the duty of government. I wish to particularly emphasize the need to protect the elderly and vulnerable, those who have pre-existing conditions, who are the most affected when it comes to fatalities. In this connection, the Ministry of Health will next week launch an advocacy campaign in which a representative of the Honorable Minister of Health will visit states, hotspot states that require encouragement to discuss their specific challenges and needs and find ways of stepping up sample collection for testing. I have also directed the Department of Hospital Services to work with NCDC to design criteria and a strategy for sentinel surveillance with sample collection at outpatient units of federal health institutions and their outreaches to augment and support the work of state authorities. This should improve the test volume considerably. The evolving global situation of COVID-19 gives us much reason for concern, with over 2.8 million cases reported in the last week, with half of the cases in Europe. The UK, France, Germany, Spain, and others in Europe have resorted to lockdown and other measures to control the pandemic. With the high volume of air traffic between Nigeria and Europe, we are examining the associated risk factors for Nigeria. The PTF set up very stringent criteria and measures so far to limit COVID-19 importation. Nevertheless, 18 travelers out of over 78,000 arrivals so far were found to be COVID positive during the second screening in Nigeria. This is a relatively small number, but it could increase with rising volume of flights. Moreover, it is estimated that traveler compliance with second testing after arrival is very low, or rather not very low, but it's considerable, the lack of compliance. And this is a challenge we are responding to in innovative ways as we work constantly to improve the arrival processes for better protection of citizens. To improve function at international air and sea points of entry, the Division of Port Health Services has been directed to work with NCDC, the Ministry of Health Planning Department, and relevant agencies of the Ministries of Aviation, Interior, and Transportation to bring up new design of structures and protocols that will enhance their ability to function more efficiently and effectively and ensure reduction in the risk of importing infectious disease, especially COVID-19, by promptly identifying, isolating, and processing suspected cases before they enter the country. While we still evaluate the impact of recent unguarded mass gatherings in various parts of the country as a risk factor for spreading COVID-19, our concern is that we may find a spike in confirmed cases with the widespread disregard for preventive measures associated with the large gatherings and mass movements. We must take effective responsibility and collective responsibility for each other's actions if we are not to experience the upsurges in new cases that has been experienced in many other countries that can be a throwback to conditions worse than the present. An appraisal of Nigeria's position in the global COVID-19 space has been prepared by the Ministerial Expert Advisory Committee on COVID-19 and will be discussed at PTF before release to the public. All citizens are enjoined to do their bit by adhering to non-pharmaceutical preventive measures like appropriate wearing of face masks, physical distancing, good hand and respiratory hygiene, and avoidance of non-essential travel and visits. We should make use of technology that makes it possible for us to connect virtually with friends and family. In this regard, citizens are also again advised to postpone all air travels to high-burden countries in the world, including Europe and America, except it is absolutely necessary. The better we are able to control importation of fresh COVID-19 cases to our country, the easier we can control in-country spread and return to our normal life. We have continued to work with the World Health Organization to assure Nigeria's access to vaccines as soon as it becomes available. The Ministry of Health is preparing to sign a memorandum of understanding with a first-line pharmaceutical company in Nigeria on a public-private partnership to set up a modern vaccine production company in our country and to work towards licensed indigenous production of vaccines. Thank you for your attention.
Secretary to the Government of the Federation and Chair of the Presidential Task Force, Honorable Ministers, colleagues, gentlemen of the press. So thank you again for coming. For this press briefing, we'll quickly deal with three topics, some of which have been touched on by the Honorable Minister already. Firstly, around travel, schools, and NYSC camps. Firstly, around travel. Firstly, to be honest, whether you're in Nigeria planning to go out or you're in the West planning to come down, to be honest, if you really don't need to travel, please don't travel to any of these high incidence countries right now. If you have to travel, then the small inconvenience of filling forms, testing before coming and testing on arrival is absolutely necessary to keep and protect the small gains that we've had and made in our country. Yes, there have been some complaints about the process, but we have to implement this testing prior to travel and on arrival to keep Nigeria safe. And to remember, the reason that we have instituted these measures is to really protect the gains that we have made. We've been relatively successful in the last few months in preventing a further escalation of cases in Nigeria. And that was the reason we implemented these measures. And therefore, those measures have been successful up till now, like the Honorable Minister just said, in limiting the number of cases, positive COVID cases that have come into the country out of the small proportion of people that are actually reporting for their second test. So measures will now be implemented to enforce the taking of that second test. We know there are some difficulties, but we'll work very hard to make sure they're alleviated. The post-arrival test is required to cover any infection from the point from the 7 days prior to travel, infection during travel, and infection on arrival. So it's not a nice to have, it's actually a very important step in protecting our country to ensure that that second test is done. And that is also why we have to isolate for 7 days after arrival. So these are very necessary small steps. Now, there have been a few complaints about the reason for payment, but we have explained this. Travel is mostly a choice, and if you have to travel, we at the moment can't afford to use public resources to support your testing, so we encourage you to use the private labs to continue to do this. The prices range from about below 40,000 to 50,000. All of this go directly to the private labs, some administrative costs to the states. None of this comes to the federal government or any of our agencies. So this is really just to manage the process of testing itself. Over time, there might be opportunities to push this down a bit further, and we're working with all the stakeholders to do this as much as possible. When you do arrive in the country, it is also important to adhere to the 7 days rule. We know for a fact that many people are not doing this on arrival and have proceeded to engage in the activities for which they have come home to do. Sometimes this includes weddings, burials, social functions that put other Nigerians at risk. It is a small price to pay right now to protect these gains, so we keep encouraging those that have come back to Nigeria from high incidence countries, even when they think they are not infected, to please adhere to the 7-day requirement for isolation on arrival. It also doesn't, you also have to continue carrying out the other measures, including wearing a mask and distancing from others, and really, those coming back have an increased responsibility to do that, not a decreased responsibility. So it's very important to adhere to these measures. On our website, we have details. If you have any question, please write us an email on travelportal@ncdc.gov.ng. We have increasingly improved the frequently asked questions on our website based on inquiries we get from members of the public. That website is updated almost every day. We also urge all travel agencies, airlines, the Nigerian High Commission to place pop-ups on their websites that redirect travelers to the NCDC website where all the information they require is available. We will continue over the next few weeks amplifying these messages through all communication channels possible so that we protect these our gains. We see numbers rising across the world. It is not inevitable that we will have a second wave in Nigeria. It will depend critically on the work that we do together to prevent this from happening here. The second topic I'll touch on quickly are schools. Schools have now reopened across the country. We've worked very hard with our colleagues in the Federal Ministry of Education and states across the country. Set up very many measures to protect our kids and ensure that as much as possible we prevent further transmission. But we can't just rest on our oars now. So we are suggesting both a few measures that every school in Nigeria has to remember to do as much as possible. We understand that resources available to schools are different, so not every school might be able to do it at the same pace. But every school needs to understand what they should aspire to do. So 5 things schools themselves should put in place is up-to-date information on the health status of every student, a clear communication plan of what to do when there's an outbreak or cluster or even a single confirmed case in the class. So the school knows exactly who to tell, when to tell, and what to do. A triage station is important at the beginning, at the entrance to the school to screen patients and make sure to screen people coming into the school, and if you're sick, have a place to put them. Continue training on how to manage a holding area for sick staff or students and where to keep PPEs that are being supplied, and identification of a sample collection site that they can access. So these are very important for every school. These are just reminders. All this information is available on the instructions that we have collectively developed for schools reopening. But the key thing is not to remember that the responsibility not only lies with schools but with parents. So all staff and students 6 years and above are expected to wear face masks. We're not going to go around schools policing this. We expect parents to make sure kids have access to masks before going to school. It's a price we have to pay for the reopening of schools. The alternative is to keep them shut, something we don't want to do. Ensure classrooms are well ventilated, windows are as open as possible. Ventilation has been shown to be a critical way of minimizing the risk of infection. Provision of hand washing facilities should now be a no-brainer. We know there are some resources involved, but that's something we all have to work towards. Communicate to everyone through meetings, communication platforms, WhatsApp message platforms, PTA meetings, so that we collectively hold ourselves accountable as parents and teachers and ensure that each school has a trained team that can respond. So these are just a few reminders of what we need to continue doing in our education settings to prevent infections. And finally, we've been working extremely hard over the last 2 months with the Nigerian Youth Service Corps to reopen youth service camps. We've made a lot of progress to ensure that we can do that safely. We know that corps members are normally young, mobile populations, and the data show us that at the moment their risk perception is the lowest among all population groups. So young people feel that they're not at risk. And yes, the risk is a little bit lower of having severe infection, but low risk doesn't mean no risks. And we have to work together to support the parents that we might be exposed to post-camp as well. So again, we're counting on not only the young people going to camps, but parents, because every young person going to camp will be living in a home where he or she has parents right now. So we need the parents to support young people living home to go into NYSC camps, to do what they have to do, encourage them, support them as much as possible. Everybody reporting to camp will be tested with one of the new antigen-based tests. The process of procurement is almost complete, and so we'll be testing everyone. That will enable us, firstly, keep our camps safe, but also help us understand what is going on in the rest of the country. Risk assessment, IPC risk assessment of all the camps has been happening over the last few weeks, and through it, advise, infrastructure, and other support to make the camp safe. So parents should rest assured that we've done everything possible together with other stakeholders in this to ensure that our children are younger, people are safe in camps, and there won't be any big outbreaks. If there are outbreaks happening, we know exactly, we have plans in place in terms of how to respond. So together with the PTF, the ministries involved, the NYSC themselves will work very hard to ensure a safe reopening of NYSC camps across the country. In addition, we've launched something called the IPC Core Vanguard in all the states. So these are young people interested in IPC themselves that are being trained. So there's a kind of self-management and self-regulation in the camps as they open. And we continue to use all means of communication, traditional and social media, to get the word out. So I'll pause there. We are not out of the woods by any means. We're faced with a situation where things that we need to survive are also the things that put us at increased risk. It's a very difficult situation. To reopen our economy, to reopen aviation, schools, NYSC, these are things that we need to restart our society. But they are also exactly the same things that put us at increased risk of infection. So we have to do these things a little bit more carefully in order to mitigate this risk. So please, let's continue working together. We have so far managed to reopen our offices, reopen our airports, reopen our schools. The next step is NYSC camps. But now is not the time to drop the ball. Rather, we need to tighten our belts and keep pushing to keep infection rates as low as they've been in Nigeria. Thank you very much.
The chairman of the Presidential Task Force, honorable ministers, members of the PTF, gentlemen of the press, good evening. I think most of the things I wanted to say have already been said by the Honorable Minister of Health and the DG and CDC, but I'll still go through a couple of points. First of all, testing. So this week marks the beginning of a major initiative of increased testing for COVID-19 in the country. And congratulations to Lagos and FCT for hitting their target of testing at least 1% of their population. In fact, FCT have tested 2% of their population, which was the upper margin of the target that we have given. 3 states are well on their way: Plateau, Gombe, and Rivers have already gone beyond the 50% mark of the target. But a large number of states have not even reached a quarter of this. And we continue to be very concerned because we can say with a fair degree of confidence that we know what is happening in FCT and Lagos when it comes to COVID, but we cannot say the same of other states. So this week, and progressing from this week, we thank all state governments for their cooperation and effort towards opening up new sample collection centers across the country. We have given resources to the state governments. Every state has received at least ₦1 billion. The state governments have received the single largest bulk of the PTF funding that has come from the federal government. A total of up to 50 billion naira went to the state governments. So we now have enough resources at the state level to be able to push for increased testing and improved surveillance. And we'll continue to work closely with state governments and urge them to make use of these resources for the purpose that the federal government has given. We have to invest in making sure that the pandemic comes down. There's no doubt we have not flattened the curve yet. For those of us that follow the numbers very closely, despite the fact that we are not testing enough, but we know if you follow the numbers on a week-to-week basis, you probably would have noticed a change in the trajectory over the last 1 week based on the numbers we are releasing. So please, if you have symptoms, get tested. There is nothing to be afraid of. If you are positive, we will take steps to make sure that you are managed properly and it will stop you from infecting your loved ones, your work colleagues, etc. And all of us have a role to play. Over the last few weeks, we've taken the initiative of opening up our economy. The combination of opening workplaces, opening schools, opening markets, opening our airports, and test needs to be done at day 7 and fails to present for testing despite reminders, it's very difficult to understand. And the reason why we test at day 7 is in order to pick up those small percentage of individuals that would have been incubating the illness on their way into the country, and also allow people to stop isolating at day 7. We know there have been issues about the cost of the PCR testing and why it's being done in the private sector. The cost of the tests is determined by negotiation between the private laboratories and the state governments. The role of the PTF is to make sure these costs are not excessive. We have taken it as a priority to continue to push the cost of the PCR testing down. When we started off with the Abuja portal, the cost was about 42,000 naira per test. It's now 39,500. Just last week, we directed the Lagos portal to stop charging passengers outside Lagos 50,000 naira plus, and the passengers outside Lagos will go onto the Abuja portal for the southwestern states, which will now be 39,000. Kano is charging 36,000 per test. The Imo portal is charging 38,000 naira per test. This is all based on negotiation with the state governments, but overall, our plan is to continue to push the cost of the PCR test down. We continue to supervise the private laboratories closely to make sure that they fulfill their own part of the bargain. We have opened sample collection centers or teams working with the private laboratories throughout the country so that passengers do not need to move around in order to have a test at day 7. But as mentioned by the chairman, we have to make sure our quarantine rules are strict if we want to stop transmission in country, if we want to stop repeated reintroductions of COVID-19. We are looking at our data, and over the next few days, we will be publishing a list of the first 100 passports that we will suspend for passengers that have failed to test at day 14. We will recheck with these passengers to make sure that they have not had a test by day 14. If there is no reason for them failing to do so, we will suspend the passports for 6 months. This is the only way we can enforce testing at day 7 and make sure that we follow up those that are infected. The alternative is to stop flights from countries with high prevalence. And I don't think this is an alternative that is palatable to most of us, because we need to keep our economy up and going. And for this reason, we will start enforcing what we have right at the beginning of this protocol stated, and which we already have approval from Mr. President to do so. These measures are not punitive. We know that the pandemic is not over yet. We cannot retrogress back to where we were before. There's a very real risk that we could end up with another second wave. And we do not want to find ourselves in the situation we were back in March, April. So let us please be responsible, and let us please protect ourselves and our loved ones. Thank you.
Thank you very much, the National Coordinator. The Honorable Minister of Environment has a special request. We are inviting him, please, to the podium to reach a segment of society to be carried along in this briefing. The Honorable Minister, please.
Mr. Chairman, PTF, members of the PTF, distinguished guests, ladies and gentlemen and ladies of the press, good afternoon. From the Federal Minister of Environment, I will not be repeating what the NC or the NCDC DG said, but I will repeat that in Hausa. I think we need to get across to people on what is happening currently as regard to the containment effort by the PTF. Jama'a assalamu alaikum. Wato ina so ne dan jaddada a harshen Hausa abubuwan da aka faɗa yau. Idan kun lura za ku ga yadda suke magana akwai alaman ɗan damuwa kaɗan. Ba ko wani dalili ne yasa haka ba, sakamakon ganin yadda ita wannan cutar take ɗan ƙara yaɗuwa a ƙasashen Turai, kamar al'amarin ya ɗan fara jagulewa kaɗan. Bayanin da muka riƙa yi kenan baya na cewa kada a yi saurin ajiye garkuwanmu domin da sauran rina a kaba. To su da suka ɗan yi watan gaririya da ƙa'idojin suka fito suka ci gaba da shargalle cewa ta tafi. To gashi nan bata tafi ba, ta dawo. Yanzu maganan da ake yi ƙasashen duniya manya su Amerika, ƙasar Faransa, Ingila da sauransu sun ƙara komawa dai wannan dokar zaman gida ɗin saboda ta jagule. To wannan abu ne wanda yake dole mai hattara, musamman ana yawan tafiye-tafiye, a yi tafiya a dawo. Akwai ƙa'idoji da aka sa na idan ka yi tafiya zuwa ƙasar waje, ko ka je ko kin je. Akwai ƙasashen da ba za ka fita ka je ba ma sai ka yi gwaji na ita wannan annobar. To kuma in an ka dawo za ka shigo ne da cewa ka yi gwaji ba ka da ita ka dawo Najeriya. Dokar kuma shine in ka dawo ka wuce gida a matsayin ka dawo ba ka da ita kenan. Ka wuce gida ka yi zama na aƙalla kwana 7, ka keɓe kanka ko ki keɓe kanki. Bayan kwana 7 a kwana na 8 mutum ya yi gwaji. Wannan babban doka ce kwarai da gaske, saboda mutane ba sa bi yadda ya kamata. Yanzu wannan kwamiti na shugaban ƙasa akan daƙile yaɗuwar corona ya fara tsari na yin wani abu na hukunci a sakamakon ƙin ka zo ka yi wannan gwaji bayan kwana 7. Me yasa abin nan yake da mahimmancin yi? Saboda ga waɗanda suka dawo kwanakin baya, a cikin kwana 7 ɗin nan da aka yi gwaji an ga mutane da dama waɗanda suna da shi. To idan kuwa ka dawo ɗin kuma baka je ka keɓe kanka ba, don saboda bata gama nuna a jikinka ba bare ta fito a gani, ka je ka ci gaba da harka, Allah kaɗai ya san yawan mutanen da za a sama. Wannan kuma shine zai ƙara dawo da ita, kamar yadda abin da yake faruwa a ƙasashen Turai. To ba ma fatan haka. Ya zama wajibi jama'a su bi wannan doka. Gwamnati da gaske take yi, kamar yadda na ce, akwai yanzu hukunci da za a yi in aka gano wanda ya dawo ɗin yaƙi ya je ya keɓe kanshi, kuma yaƙi ya yi gwaji bayan kwana 7 zuwa 8. A yi hattara, in kunne ya ji gangan jiki ya tsira. To kuma babban al'amari ga wannan shine ba kai kaɗai za ka yi ma ba. Ka dawo ka ƙi bin umarni, yana iya yiwa ɗin ka ɗauko ka je ka sa ma 'ya'ya da jikoki. Subhanallahi. Daga baya in ka gano me za ka ce makanka bayan ka san kai ne ka ƙi bin doka. To mutum ya duba kanshi sannan ya tunanin kuma waɗansa da zai iya cutarwa. Abu na uku da ya sa kuma ake da damuwa har yanzu, ga maganan buɗe makarantu. Ya zama wajibi mu ci gaba da ƙoƙarin dai farfaɗo da arzikin ƙasa da al'amuranmu. Kusan kenan ga cuta tana so ta dawo, ga kuma dole mu fito mu ci gaba da tattalin arziki. Wato kamar ya kasance kenan gaba kura baya siyaki. To wannan ba shi zai hana mu ci gaba da yi ba, amma da me taka tsantsan. Taka tsantsan ɗin shine bin doka. Makarantu da za a buɗe mun kirawo ga iyaye baya da su tabbatar da horar da yaransu, tarbiyyantar da su da yin abin da ya kamata da barin abin da bai kamata ba, bin umarni da dokoki daga wajen malamai ko ma'aikata da dai sauransu. Har ila yau mun faɗa muku cewa akwai jami'an lafiya a makarantun nan, suna nan suna ci gaba da aikinsu, muna kuma bukatan a ci gaba da ba su haɗin kai don shi ne zaman lafiyanmu. Har ila yau akwai shiri na buɗe cibiyoyin horar da masu bautan ƙasa, wato NYSC camps kenan, domin za a ci gaba da kamar yadda muka ce ƙoƙarin tafiyar da harkoki, ba za a yi ta zama hakan nan ba, amma da mai a yi da taka tsantsan. To shi ma ɗin akwai shugabannin lafiya da za a sa, shi ma kamar yadda muka ce ne a karantu, mutane su bi doka, 'yan bautan ƙasa su bi doka, domin tun daga nan ne ma kake fa dasa albarushin tabbatar da cewa ka zama ma ɗan ƙasa na gari, ka yi karatu ka gama, za ka inganta ci gaban tattalin arziki na ƙasa, kuma ya kasance kai ma mai jin mai kuma bin umarni mai kishin ƙasa. Wayannan su ne abubuwan da nake so in jaddada mutane su sani. Har yanzu dai akwai saura, muna gani abin da yake faruwa yanzu, to ya zama wajibi mu ma mu ci gaba da wayannan ƙa'idojin na sa takunkumi ɗin nan. Har yanzu muna ci gaba da sa namu na wanke hannu ko amfani da sinadari da zai kashe ƙwayoyin cututtukan nan, da kuma tazara wajen mu'amala. Mun lura mutane da yawa yanzu sun fara watsar da sa wannan takunkumin, suna kuma ci gaba da bukukuwansu, suna rawa suna shewa. To wallahi a yi hankali, a yi hankali. Mu kuma gode ma Allah, mu abin bai yi mugun tsanani ba a nan, to kada mu bari ne abin da zai sa abin ya zo ya zama wani abu daban. Allah ya kiyaye. Mun gode.
Thank you very much, Honorable Minister of Environment. We deeply appreciate. The time has arrived for us to now take a few questions. So if we're ready, let's take question number 1.
The Chairman, National Coordinator, members of the PTF, my colleagues. My name is Amaka Ode. Excuse me. I report for Arise News, and my first question actually goes to the DG of the NCDC. Well, the CDC in the US actually advised that children from the age of 10 should wear a face mask. But from what you have told us and what we've seen on your website, the NCDC in Nigeria actually advising that children from the age of 6 should wear one. Is there a particular reason why we're doing this? Are we seeing a transmission from children to parents in Nigeria? Why are you actually bringing up the age to 6? We need that clarification from you. And also staying with you, the DG. Well, we're seeing some states now relax some of the protocols that you've actually put in place since the beginning of this pandemic. I'm talking about states like Ondo and Ekiti State, and even Ogun State. They're talking about lifting their social distancing protocols as it concerns churches, religious houses in general, and even social gathering. How do you think this will impact our response, to deal with the pandemic? So those are the two questions for you. My next question is for the Minister of Health, Dr. Osage Hanire. Post-COVID illnesses, do we have a data as to people who are suffering from some post-COVID illnesses? Some of them, I know I've had an opportunity to speak to some of them. They're talking about heart palpitation, all sorts of symptoms. Do we have the data as to people who have actually developed some other health symptoms that they never had prior to them getting infected with COVID? We need that information from you. And staying with you, Honorable Minister, there was an article I read about how COVID-19 actually affects pregnant women, and it could lead to premature delivery. Have we done any research? Have we seen anything from, the infections we've had in Nigeria? And is this actually true as it concerns Nigeria's response to COVID-19? Thank you.
Good evening, members of the PTF. My name is Juliana Taiwo Baloyin of the Sun newspapers. I have just one question for the Minister of Health. I just want an update on the Federal Medical Center, Lokoja, that has been shut down for the past 4 months. The ordinary citizens are the ones suffering because they can't afford the luxury of going to private clinics. So I'd like to have an update on that. Thank you.
Thank you for those questions. It appears today would only take the Honorable Minister of Health and the DG NCDC. At this point in time, may I respectfully invite the Honorable Minister of Health to the podium. Honorable Minister, sir.
Thank you very much. I will start with the last question, which is about FMC Lokoja. As you know, that medical center was shut down when a group of people stormed the place and drove everybody out, scattered the office, and sent patients and staff scampering. The issue has not yet been resolved. The staff agreed the other day, about I think a couple of weeks ago, I met with the medical director who was preparing to reopen. But at the same time, we are still trying to iron out issues with the governor, who has his own complaints about the operation of the hospital. And the issue is being handled by the Minister of State about the differences between the governor and the medical director. We shall form a team that will go to Kogi to go and iron out the service so that the people of Lokoja, people of Kogi State can begin to get treatment and get medical attention and don't fall behind in the indices. Now, the other question is about pregnant women and COVID. We do not have data yet. We must know that COVID is with us only since January, or rather since February here in Nigeria. I'm also not, I'll probably leave that question to WHO. WHO, they probably have larger data than we do because they're looking at the whole world. And perhaps NCDC also has data from the world. But here in Nigeria, we do not have enough to actually be able to make a categorical statement. With regard to post-COVID illness, yes, it has been widely reported. There are people who fall very ill. There are those who are not ill at all. There are those who get very ill. And among those who get very ill, there are those who recover completely. And there are those who have lingering symptoms. Many of these lingering symptoms are said to be sensorineural. They affect the senses, the feeling, ringing in the ear, headache, and feeling of anxiety. Again, this is a subject matter that is being investigated, is being studied. It is said that those who have these symptoms are those for whom the treatment was particularly long. If the treatment took a long period of time, beyond 17 or 20 days, then you have, the more these symptoms will be. But again, those who have larger data, again, WHO will also like to say something about that because they look at all these things from a global point of view. But from our own experiences here, nothing categorical can be stated because the number of cases are few. And I spoke with the Chief Medical Director of Gwagwalada Teaching Hospital on the subject matter, and he has observed it himself, but they are not enough for him to be able to make any generalizations on it. But it is present, it does exist. The number of people who suffer from it is not yet very clear, and then the follow-up
Schools have become virtual. By nature, Africans and Nigerians particularly want this physical contact because that's how we are. That's what we are made of. But that definitely must cease for now so that we can quickly transit, if we can calm this thing down as much as possible, and eventually open up when we have reason to do. Assuming vaccine is available in the next 1 month, how many people will get the vaccine in the next 6 months? It's going to be highly competitive. So I'm not looking forward, let me tell you the truth, as a person, I'm not looking forward to the vaccine. I'm definitely going to take the vaccine once it is available. But for now, I must survive to get to the point that I will take the vaccine. So my major consideration is to make sure that I survive before we get to the point of the vaccine. Dr. Sani has given some further explanation as to the actions of sanction that we intend to put in place. Assuming you have 30 passengers and just 1 out of 3 turn up for the in-country test, which have eventually, it has been paid for. So what stops you from going for the test? So that we can have a balanced picture of what we are dealing with. Because the major concern now, in addition to the community transmission that is going on, is the one that is going to be reimported. That's our major concern, reimportation of the virus afresh. You know, we have joked about it here severally, whether the one we have in country is not as potent as the one that comes in. So let's manage the one that we have in country and not allow for reimportation. Those that have not carried out the second in-country test will be given an opportunity to explain why they have not. And certain considerations will be put in place. But if it is confirmed that you just decided that you are not going to take a second test, in spite of the public health challenge that it poses, definitely sanctions will be applied. So I want to thank you for this evening and I wish you a very wonderful day. As you watch the American elections, I know some of you will stay awake all day to ensure that you cheer up your parties by proxy. And I wish you, may the best man win the elections. Thank you. Thank you.
Amen. Thank you very much, the SGF, for uplifting our spirit this evening. Well, we need to take away some messages since we've been here. And I know that our listener and our viewer at home are looking forward to this segment. It's a pleasure at this time to invite the Permanent Secretary, General Services Office, Office of the Secretary to the Government of the Federation, Dr. Namdi Morris Berry, to please give us the takeaway message.
The Chairman, sir, the Secretary to the Government of the Federation, the Honorable Ministers here, and other members of the PTF, gentlemen of the press, ladies and gentlemen. Today's briefing has actually anchored around passionate appeals from all speakers for us to take a number of measures. First and foremost, we are meant to remember that we are not yet out of the woods. And so, we should take responsibility for all our actions to stay alive. You remember that a lot of openings have been made in the recent time in order to reactivate our economy. And we're also reminded that these openings are also sources of risks to us. So what that means is that we have to tread with caution. The openings, like reopening of schools, reopening of airways, reopening of NYC camps and the rest of them are sources of very high risk as far as this pandemic is concerned. So we have to be very, very careful. And what this means is that testing remains very critical, very key to our survival. So you are advised that if you have symptoms, if you have any symptom, please get tested. And you all remember that low risk does not in any way translate to no risk. So we have to be guided. And if there is no pressing need for you to embark on any journey, on any travel, any day, please do not travel. We should be responsible, and please let us do all the things that we need to do to keep our loved ones alive and to protect them. In that case, it is too early to down our guards, so we should continue pushing in order to remain alive. On that note, with the closing remarks from the chairman, the Secretary to the Government of the Federation, we come to the end of today's briefing. I want to thank everybody that has participated here today, and we pray to keep our hopes alive until we meet again next week, Thursday. God bless you.
Nigeria, a nation of great people, different tribes and languages.